Now let's begin talking about medication management and effects. So we know that there is a strong correlation between GERD and IPF because GERD causes regurgitation back into the esophagus, which then leads for the lungs to microaspirate these acids and create fluid buildup in the lungs. And obviously we don't want any fluid in our lungs. So the doctors are treating the GERD symptoms with omeprazole, which decrease the amount of stomach acid buildup and thus decreasing the amount of regurgitation, decreasing the amount of microaspirations into the lungs, improving lung function. So omeprazole has shown to increase risks for joint, bone, and muscle pains in the long run, as well as femoral neck fractures. So they are coupling it with alendronate, which helps reduce the risk for osteoporosis by inhibiting osteoclasts and allowing osteoblasts to lay down stronger bone density. So side effects of those are headaches and or abdominal pains, as well as the stomach pains or nausea and diarrhea. So we have to be careful with these patients because obviously they're going to be in a lot of pain and we need to be careful with them. Then the patient is also taking tacrolimus and mycophenolate mofetil because it is an immunosuppressant which helps decrease the amount of immune system activity, which allows the body to accept the organ and not reject it, because there's something foreign in the body now that the body's obviously going to reject it. So decreasing the immune system allows the body to accept it much easier. And as well as the inflammation and irritation in the esophagus, diaphragm, and all of those areas in the lungs, they are also giving her prednisone to decrease the amount of inflammation. We need to be careful with these patients because these drugs can cause dizziness, drowsiness, numbness and tingling in the feet and hands, loss of appetite. The patient might not have the energy to work and to exercise and increase their mobility, so we need to be careful and slow and treat them with patience.